We started addressing the Ebola outbreak in Africa actually several months ago, prior to it arriving to the United States. We took a look at, we need to get some information out to our staff, let them know what it is, what's currently going on in Africa, and that's West Africa. So we did that through our educational website, HealthStream. So each employee had the ability to go through, take a look at what exactly Ebola is, what's going on in West Africa. So therefore, from there, the emergency director and I started having conversations, as well as listening into webinars and things that had come available to see what recommendations were, what actions we needed to take to get ahead of this in case it did come to our country. We have had emergency preparedness meeting where we have a team of lots of different disciplines. It's not just infection control, but it's our emergency management director, our ICU nurse or director, our emergency room, plant operations, which is our mechanics and engineers. So we include, there's lots of people on that team. And this is a team that meets monthly. And each year we develop what we call a risk assessment. And we put some of the possible things, tornadoes, hurricanes, things like that go on the list, earthquakes because of our fault line, information like that, chemical spills. We do drills pretty consistent. We've even had our hazmat tent set up in the parking lot of the ER and get dressed out in hazmat suits to decontaminate patients that may be in a chemical spill. So Ebola preparation kind of goes through this committee as well. So we take a look at how can we best protect not only our patient but our staff as well. So from the moment a patient may call 911, dispatch has the questions to ask. How are you having any signs and symptoms? Have you been exposed possibly to an Ebola suspect or been in an area where the transmission has been documented? And if that patient answers yes, then they go through a screening and, how are we going to send our EMTs out there? How are they going to be prepared? Ambulance preparation, things like that, before they ever make it to the hospital. And then there's key communication set up there that they're going to notify our emergency room, we're coming with a possible Ebola suspect. Get your plan and protocol ready to go. And then also that, they may not call 911. They may just show up at our ER doors. And from that point, they would answer those questions at the moment they register at the front desk. And then from there, the protocol goes into action. They answer yes to any of those things, then we're going to hand that patient a surgical mask. We're going to have them step back outside of our emergency room, and we're going to have the team get ready, and they're going to take that patient to our negative pressure isolation room, and we're going to place that patient in that room and contact our Mississippi State Department of Health. And then we're going to go from there as far as what recommendations are from that point forward. Actually, there is no current treatment. The treatment would be for what the side effects, what the dehydration, it affects the liver and the kidneys. Most of the time, that's what we're going to be treating, providing them with fluids. Their blood pressure may drop because of loss of fluids. There are treatments that they are looking at. There's something that they're called ZMAP, which I think that they have been giving that to some patients. I want to say the physicians that came from Africa that were first treated, that was something that they had looked at giving them to see, does it work? Can we mass produce this and use it as a curable medication? But it's not to that point yet. Yes, what CDC is stating is that, and what it is, they've done studies, and that's what they have found, that it's only transmitted through blood and body fluids. And when you say body fluids, it's not just urine and stool, it's also in sweat. These patients could be sweating profusely if they're very sick. If you've got something, a stomach virus, that fever, things like that.
Even a cough and a sneeze.
Cough and a sneeze, that's another way. That is part of the body fluids. It's droplet and contact. We have only had just a couple of cases actually of people that have been diagnosed with Ebola in the United States. The two physicians were flown over from West Africa. They had been working with those patients there, so they contracted the virus there. It was contained. As far as I know, there's not been any transmission from those patients. However, there has been the transmission between the nurses caring for the patients in Texas. So I think that has just blown up. I don't think there's a reason to panic, but I think there's a reason to be aware and prepared.